Hi guys, I'm Dr. Allison Young from the Eye Surgeon channel, and today we're going to be talking about one of the most common questions I've been getting during this quarantine time, which is, what do I do with my red, crusty eyelids, and what can I do from home so I don't have to go to the eye doctor? So today we're going to talk about blepharitis, which is the usual culprit, and some really easy steps you can do from home to get the eyes feeling a whole lot better. Okay, so let's talk about blepharitis. What is blepharitis? Blepharitis is a very, very common eyelid condition that I see all the time, caused by an overgrowth of the bacteria that live naturally on our skin. You know, we all have bacteria living constantly on the skin, and most of the time they're just living harmoniously there, not causing any trouble, but occasionally they'll get overpopulated, and when that happens in the face, that can give you acne, and when that happens around the eyelids and eyelashes, that's what we call blepharitis. So the most common symptoms of blepharitis are redness, burning, stinging, the sensation that something's always in the eye, which we appropriately call foreign body sensation. And when you wake up in the morning, you've got that little discharge right in the corner of the eyes. All of these things are associated with blepharitis. So two main things we see in eyelid anatomy with blepharitis. So first, just for a little review, this is a nice, normal, healthy eyelid. We've got lashes that are nice and clean, and directly behind those eyelashes, in most of us, in each of our lids, we have about 10 to 15 oil glands. And the job of those oil glands is to secrete that oil onto the surface of the cornea so it keeps our tear film nice and stable, keeps the eyes feeling comfortable, keeps the vision nice and sharp. When those oil glands get plugged, as they often do in blepharitis, they cause a series of kind of a cascade of effects. So this is what it looks like when they get plugged. So instead of that nice clean margin, you've got all of these little plugged oil glands. The skin around the oil glands gets kind of congested and angry and swollen, and that's what causes that soreness. And then without that oil freely flowing onto the surface of the cornea, our tears evaporate too quickly, and evaporative dry eye starts to take effect, and that's what gives you a lot of the stinging and burning. So how do we treat this? Well, if you imagine all of these oil glands are like a bunch of teeny tiny little sticks of butter, we need to melt that butter, and the easiest way to do that is with heat. And so a real simple thing you can do without having to buy a thing is take a washcloth that you already have at home, put it under the hot water, wring it out, put it over the eyes for a few minutes, and that works okay. The problem is, as you would imagine, after just a few seconds, usually that washcloth is kind of dissipating that heat, and you can't get the heat to stay for very long. And so for that reason, a lot of companies have come up with some great little microwavable masks like this one. This is a brand called OcuSoft, but there's a lot of different brands out there, and I'll mention a couple of them in the description below so that you can check those out if you'd like. But this one's nice. It's very easy to use. It has a little elastic band, and you just throw it in the microwave for about 10 or 15 seconds. Make sure it's not too hot so you don't burn yourself. And then just put that right over the surface of your closed eyes and hold it there for about 5 to 10 minutes. That's going to melt all of that oil, that butter, and allow that oil to freely flow over the surface of the eye, and it feels really nice. So it's a nice, easy trick to do at home. So that's going to take care of what we call posterior blepharitis, which is all of those plugged oil glands. But what about all these crusty guys on the front? This is called anterior blepharitis, and these little crusts are called collarettes, and that's what gives you that sensation that something's in the eye and that you're always just kind of itching and wanting to mess with the lids. So to get rid of this, we use a dental analogy. So of course, all of us, would never argue with our dentist that it's appropriate to brush your teeth morning and evening at the very least to make sure that that buildup of plaque and tartar is removed mechanically every single day. And similarly, when this kind of builds up around the lids and lashes, we can also kind of do some lid brushes, lid scrubs. This is again one of many different kinds of lid scrubs. This one's again by OcuSoft, but there's a lot of different makers. And basically the gist is it's a small little towelette that has soap that's safe to use around the eyes, and it's really simple to use. You just open the scrub. Here's the little towelette. It's got a little bit of texture to it, which is nice. It's really pull off all of those crusts. I like to kind of wrap it around my index finger, and then with your eye closed, you're going to start all the way up at your brow and go back and forth until you kind of feel that bony portion of your orbit. So from the top all the way to the bottom of the eye. Then you'll just flip it around and do the exact same thing on the other eye and then throw it away. These are meant to be done just the same times that you brush your teeth. So morning and evening is when I typically recommend folks do this. And if you can get into that habit of doing both the lid scrubs and the warm compresses, usually that takes care of blepharitis for most people. In general, I try to encourage patients to, again, think about doing lid scrubs at the same time that you're brushing your teeth. So morning and evening, you should be doing the lid scrubs. The warm compresses, which are best done at nighttime, I recommend doing the warm compresses first for 5 to 10 minutes, get all that oil coming out, and then finish cleaning the lids with the lid scrub right before you go to bed. The reason I like to do the warm compresses at nighttime is that as that oil starts to open, the glands open, and the oil flows onto the front of the eye, that can blur you a little bit. So if you try to do that first thing in the morning, you might be a little frustrated with me. But if you do that right before you're going to bed, you're going to bed anyway, so it doesn't matter. Typically, this will resolve your symptoms. Now, sometimes blepharitis can be, especially stubborn, and patients will say, I'm doing all of these things regularly and it's still not helping, and that's when we need to call in some of the bigger treatments, including medications, either topical or oral antibiotics, sometimes a little mild steroid drop or ointment. There are several in-office procedures that we have available for blepharitis as well if needed. Those can certainly be the topic for some other videos to come, but for now just wanted to give you guys 2 simple at-home remedies for blepharitis, and hopefully that will have everyone feeling better really soon. All right, guys, well, thank you so much for watching. I hope that was a help to you. If you like this video, please remember to like, and don't forget to subscribe to the Eye Surgeon channel so you can stay up to date with all of the new content as it becomes available. Thanks and have a great day.